What's up, guys? Welcome back to another episode of the Dad Bod Pod, a place for men to learn, grow, and live the healthiest life possible. I'm your host, Jason Priest. We've got an exciting episode for you guys today. You do not want to miss this one. If you're a brand new listener, I highly encourage you to go back and check out some of the prior episodes. There's a ton of valuable lessons to be learned there, a lot of motivation, inspiration, education to help you become the healthiest version of yourself. If you're a longtime listener, you know that we don't run ads on this show. We will never run ads. We respect your time. We want to give you as much value as possible. The only thing that we ask in exchange is if you could take 10 seconds out of your day, just drop us a quick review. Let us know how we're doing. Let us know if there's any content that you would like to hear more of so that we can continue to crank out valuable episodes week after week for you guys. So with all that being said, thank you so much for being here. I have an awesome interview for you guys today. With me today, I have Dr. Aaron Hartman, who is a board-certified family medicine practitioner, a clinical researcher, and a functional medicine practitioner. After years in family practice, he felt called to make a dramatic shift and began to pursue functional medicine for his own family's health. Soon, Dr. Hartman recognized the benefit of functional medicine for anyone who has suffered unnecessarily from a system that fails to support whole person health. Dr. Hartman, welcome to the show. I'm excited for this interview, man. Thank you so much for taking some time out of your day to add value to our audience.
Jason, I'm excited to be here. I enjoyed our conversation already before we kind of went live, so I'm super excited to see where things go, and hopefully your audience gets a whole lot out of this. So
yeah, I know they will, man. Just off the short conversation you and I had, I think that we hit it off, man. There's a lot that we can touch on, and we even made the joke that we could go Joe Rogan style and go 5 hours deep. Don't know that we're going to do that, but we definitely will hit on some things that they will find value. So I'm going to go ahead and get my first scripted question out of the way so that we can just jam. And that's really just to get your take. I mean, in your introduction there, you know, obviously there was some, some verbiage around a system that fails us, right? So I'd love to hit on some of that, but what is your take just in general? Obviously our company is called Dad Bod Health. This is the Dad Bod Pod. And so we're a very male dominant audience, but what is your take on not just the Dad Bod, but where we're at as a country, really when it comes to health? Obviously we have this obesity epidemic that was an underlying issue for a long time pre-pandemic. And so what is your take on where we're at and where we're headed as a country when it comes to health?
I mean, if you just look at I'm a numbers guy. Just look at the statistics. You know, half of America is diabetic or pre-diabetic. 15% of Americans are diabetic. You know, you look at our kids, 30% are obese. If you look at diabetes in kids, in 1980, there were no kids in the medical literature with type 2 diabetes. You know, when in 1996, when I started my residency program training, I was told I'd never see a kid with type 2 diabetes. It's so crazy rare. You know, I diagnosed my first case by 2003. Now we're expecting 25% of kids to be type 2 diabetic in the next couple of years. 1 out of 12 Americans has an autoimmune disease. 1 out of 2 Americans will get cancer in their life. Okay, so when you start looking at these statistics, you gotta wonder like what's going on. So I think, the health of our country it's a big issue. Chronic illnesses, are the biggest issue going on in our country right now. We're amazing at acute health issues. If you get in a car accident, brain trauma, complex acute issues, where people from around the world are coming into our country. If you have a chronic health issue, we're really not doing the job and things are getting worse, So I feel like, if you believe the literature that says half of all chronic disease in our country can be directly attributed to eating processed foods. If you believe from the Harvard School of Public Health that 80% of heart disease and 7% of cancer can be prevented by diet and lifestyle alone, then the major issues in our country can actually be addressed by super basic things that everybody has access to. So that's where I'm excited that message to get out that yes, we're in a bad state. We're getting worse. My hope was with the COVID, pandemic, epidemic, that it opened people's eyes. Like, hey, eating meals together, eating at home, not eating out, changing the type of fats you eat, all these things. That was my hope at the front end. The back end's been more stress, more anxiety, poor dietary choices. But at the same time, people are realizing they need integrative functional medicine, holistic view to address their health. Because when something like COVID came around, our system didn't really have any answers. And in my world, we were already waiting in prime to actually have answers to prevent COVID, to treat it, and also to treat long COVID or long haulers. And so that's where I feel like, between these two worlds of diet being a foundational thing, lifestyle, sleep, these foundational things are super important for getting people healthy and having great lives. They can be the parent, the employee, the boss, that they need to be, that they can be,
Oh, I love it. No, you're 100% right. And if you want to live up to your potential as a man or even as a person, obviously health is the foundation, right? You don't have much without health. And I like that you brought up you were hoping, right? Because when the pandemic first hit and we got a few months into it, the 15 days to slow the spread, now we're a year plus. But the reality is this, man, is like I had the same hope. In fact, we did a couple of episodes on that, thinking maybe this is the wake-up call that the country needs. Because you look at the data, the majority of people that are dying from this are either elderly with chronic conditions, like you mentioned, or they're obese with chronic conditions. And I know there's exceptions to every rule. We've lost some children, we've lost some young healthy adults. And the mystery lies within that, but like the actual data here, the trend is showing that most people that are dying are unhealthy from this, and so are unhealthy to begin with. And so I thought that it was going to bring awareness. I thought that people would place a larger emphasis on getting healthy and maintaining health. But I'm not so sure that's going to happen. And so with this trend of the vaccine, so I want to touch on this because you mentioned diet and lifestyle. I feel like if our country truly cared about our health, which I don't believe they do, and I'm talking about at a government level, right? Like they're quick to push out the vaccine. We want to get everybody vaccinated because we want to save lives. But at the end of the day, like obesity is killing hundreds upon hundreds of thousands of lives every single year. But there's no alarm going off. And to your point, we're great at treating acute things. We're also really, really good at keeping people alive past the point they probably should be alive. I'm an ICU nurse. So I've seen people being on the ventilator for months at a time. And it's like, okay, you're leaving it up to the family to pull the plug on this individual who stands no chance. So I think that technology has come a long way and it's going to continue to evolve. At some point, and I had an interview with a guy not long ago, at some point, we are going to get to a place where there will be one person in our country who is or in the world who's the last person to die of natural causes. And to me, like that's baffling, right? It will get to that point. And so to kind of transition here, let's hit on functional medicine and bring awareness around that, because I think for the majority of people out there, they hear medicine, they hear doctor, and it's automatically, okay, like what's high and what do I need medication for? It's automatic. Like that's programmed into our minds. When you go to the doctor, you're going to get tests, you're going to get blood work, you're going to get blood pressure checked, and then whatever's wrong, you're going to get Band-Aid slapped on, medication, and be on your way. They don't have time to address the lifestyle and all that. So you're getting a medication. So let's talk functional medicine. Let's unpack that for a little bit here, because I want to get on to a couple other really important topics that I think will tie into this well.
So functional medicine goes by a bunch of different names depending on, 10, 20 years ago versus today. It used to be called holistic or integrative. Some people call it biologic medicine, translational medicine. But the idea is using the most up-to-date science-backed solutions to find the root cause of someone's illness or health. Like why are you healthy, from a holistic, personalized perspective. And so what I think is unique about functional medicine that it takes the person in front of you. It's like, who are you? Jason, what are your health issues? Where did you come from? Where did you grow up? Make this personalized, not a template. I've got 1,000 guys with high blood pressure and cholesterol. I got my protocol, here you go. But personalize it to you. Science-backed and science-based is crazy, crazy important. But that doesn't mean that you have to wait for a randomized, double-blind, placebo-controlled trial to do any intervention. Because if you did that, most of what we do in medicine, we wouldn't do it. And people don't realize that. They ask this argument science, and it's like, well, you mean a randomized trial that requires a sponsor, requires an IRB, requires FDA approval. It takes 15 or 20 years for that stuff to come out. You wouldn't really wait for vitamin D. Great example, vitamin D and COVID. We're still questioning vitamin D's utility for COVID, even though we already know that 87% of people who die from this have low D. Even though we have literature in Spain using IV vitamin D, it was about 84 patients. No one died. We got that. We have studies coming out as well with oral D. You get admitted to the hospital with COVID, they give you oral vitamin D, lowers the risk of death 60%, right? Do we really need, for a nutrient, something that's safe, an expensive multi-million-dollar randomized trial that will take years and years and years to come out to tell people, get your level checked, take some D? So that's why I think like science-backed means you look at the literature, you look at the information, and you say, hey, first and foremost, do no harm. Is there harm with zinc? If your zinc levels are low, you increase risk of hospitalization with COVID 40%. No, take some zinc, right? And then ultimately, it's holistic. It's looking at the whole person, the whole picture, family. So that's where functional medicine kind of steps in. I think COVID is bringing this to the surface. Like, this is the kind of medicine people want. They want science-backed solutions. They want to be individualized, and they want to keep up with the data, not lag, the times. I mean, the example I give is it took us 4 to 5 months to figure out masks work, and still kind of questionable if they work or don't work. I mean, you're an IC nurse, the masks work, right? But it's like, but once you realize, for example, masks will slow transmission of COVID 80%. Social, being away from you 6 feet will slow transmission 80%. Being outdoors slows transmission 40-fold. So all of a sudden, just being outside is crazy safe. I mean, obviously not mass, gatherings and things like that, but
yeah,
just like stuff like that. It's like, okay, let's use that. But we're still, those concepts I said are still controversial. We're still struggling with those in the functional medicine world. We've already applied those. We've moved on. So that's where I feel like this is brought to the service, and the people are looking for this. They don't know what it's called. They might not quite, I tend not to use the word holistic because in my mind, I'm 48 and holistic has some weird, crunchy connotations to me, but actually that's what people want. They want this whole body, whole person approach to things that's science-based and looks at all other health traditions and doesn't say it's only our way or the highway,
Yeah, no, it's so funny that you went there because look, I have a hard time using the word holistic as well. I feel like I see tree hugging hippie when I think holistic. And that's just like the way that my mind is programmed. And so maybe it's just, I'll be 42 this year, so we're not that far in age. And so maybe it's just when we grew up, right? You hear holistic and it's like, like the pot smoking, tree hugging hippie. The reality is that our approach to what we do with the guys we work with is very similar to your approach. And we can call it, functional coaching, right? Or however, but the thing is the way that we look at it is it's got to be individualized. In fact, I made the decision not long ago to go and pull all of our automated stuff off the website, right? No more courses, no more automated programs. Can those be lucrative financially for our company? Sure. But we made the decision that myself and my 2 business partners, we're very much communicators. We want to communicate. We want multiple touch points, and we want to be able to help guys work through their issues without having an automated course. I don't get to lay my stamp on that per se. When you go through the course, if you have questions, like, we're not there to help you. So essentially we cut it down to 3 offers. It's really like a free group, a low ticket, and a mentorship program that's at a higher level, right? That's it. We simplified it because just what you're saying is like, people want individualized. They want customized. They don't want a cookie cutter solution. They don't want, the one size fits all approach. And I think that that's where traditional American medicine is at now. Like you said, your protocols for blood pressure, your protocols for this, that, and this, when at the end of the day, like, if you treat the person for who they are, their issues. And like we talked about earlier, before we started the show with the cholesterol issue, I was telling about one of our clients. And the reality is like, with that guy's individual situation, does he need a medication? I would say no. But if you took that same guy and you add 30 or 40 pounds, you add cigarette smoking, you add a lot of alcohol, you add processed food, and the rest of his blood work is all high, well then, yeah, maybe we consider cholesterol medication because it's a totally different person. And so I love that, I love the approach. I think that's definitely the way that we need to be headed. My question for you is, with this functional medicine approach or holistic approach, how are we going to get there long-term with the demands that are being placed on physicians today, having less and less time from patient to patient?
I think I hear your question, and that's what I struggle with personally. When you have 12 minutes with somebody, I've got 12 minutes with you, when you come with your insurance, I got a 15-minute time slot. I got to ask you my screening questions that are mandated by at a national and state level. When it's all said and done, I say 12 minutes is probably closer to 10 minutes. You have a high cholesterol. I got enough time basically to figure out which medication your insurance covers and move on to the next patient. That's about how much time I have. And so how do you take an individualized relationship-based type of care that requires me getting to know you, know your family, where did you grow up, what environmental exposures did you have, and then go through that to address your cholesterol, that's, outside, I think it's outside our scope of care of our current system, and so that's where I think, you actually mentioned your community, and I actually set up a community very similar to that, coaching. How do you help people, guide them through these changes? And I feel like that's where having ancillary providers, coaches, just a whole array of different people, including nurses, but other healthcare professionals or practitioners that actually can guide people through, the doctors probably, it's really funny. In medical school, I had maybe 5 hours of nutritional education. Wow. All my nutritional education's been all my own with all my other training I've done afterwards. Like, your doctor's probably not the best person to talk to you about elimination diet versus a SIBO diet versus an IBS diet. For weight gain, if you're inflamed, right? What's an anti-inflammatory diet? They're probably not the best person for that. Maybe a nutritionist, maybe a health coach. And so I feel like the way going forward we need to do is have a more diverse system of practitioners and providers of health information, but puts the patient at the center. You have to be engaged. This is not, the day of me writing a prescription for your cholesterol. That's still here. People still need that. But the better thing is, how do you get your cholesterol better controlled? And like that cholesterol question you said was kind of interesting. 50% of people who show up to the emergency room with a heart attack have a normal cholesterol.
Yep.
So is cholesterol the most important risk factor for heart disease? And the answer is, of course not.
Yeah.
Cholesterol is an indirect marker of inflammation. So what's that person's HSCRP? What's the particle number? And the numbers you gave me earlier on, I don't know if you want to say them here or not, but the one thing that struck me was the triglycerides came down radically.
Yes.
The person had high triglycerides. That meant they had carbohydrate intolerance or overconsumption, which are probably two sides of the same coin. I was impressed by how they went from what you said was 160.
Yeah, it was like 126 to 46.
46 is a great triglyceride.
Yes.
And so I'm like, okay, their HDL went up. HDL's
by
probably
20 points.
There's no drug that does that on the market.
No.
There's no drug. We're actually, there's a drug actually that was coming to market to do that very thing, and it actually increased liver disease. It actually got taken off it didn't make it all the way through phase 3 trials because it did a bunch of bad stuff. There's nothing that works that well. And we know HDL being up is more protective than the harm of a high LDL. And all of a sudden, those person's numbers, once you kind of calculate their non-HDL cholesterol, it was better.
Yes.
Right? So that's one of those things where, but that, to go through that and talk to a patient about that, can you do that in 12 minutes?
No.
And that's where, I think having something where like coaching, your thing you're doing, where you have people coming in, my motto is education, encouragement, empowerment. You educate people, you encourage them, and you empower them to take hold of their own health. And that's what I think the system needs to go towards. If we want to affect the population's health at an individual level, I think we need that kind of solution.
100%. And I can't agree with you more. I think it's the multifaceted approach. And to be honest with you, it's almost like what you get in a hospital if you're really, really sick. But then once you're okay to get discharged, like that goes away. Like if you're thinking about it in the hospital, you're going to have a dietitian come and see you. You're going to have pharmacists that are looking at all your medication profile. You're going to see multiple specialists depending on what they are focused on most, right? You're going to have nursing to help you with everything that they do. It is a multifaceted approach. And I think that has to transition to the outside world in order for us to really see any kind of dramatic impact on the obesity epidemic. Right now, the projection is by 2030, we're at 50% obesity rate. And right now, I believe we're 43, somewhere around there, 43%. We're not making it to 2030 before we see 50%. Like, I don't even know that we make it to 2025. I mean, you mentioned the stats with the kids. I know you're seeing a lot of the same stuff. I'm going in the grocery store these days and seeing some kids who are even bigger than their parents, and they might only be 11 or 12 years old, and it saddens me. So let's transition a little bit here. I know one thing that I really wanted to hit on is how, because you touched on this kind of in the opening spot, is how you feel like the system is failing people with chronic illness or chronic conditions. Because I believe that, that to me, from what I'm seeing, says I went from ICU to long-term care. I was a director of nursing in a long-term care facility, and then started doing coaching and got into the health and wellness and fitness space and performance coaching, and dad bod health became a thing, and yada, yada, yada. But I've seen both ends of it. And I feel like with the long-term care aspect, that's one of those situations where like these guys all have chronic conditions. They're in a skilled nursing facility and they just get stacks of medications added each time. Every time there's a new problem, a new medication is added. So Let's unpack that a little bit, because I know that there's a lot of people out there that are frustrated. They just don't feel like they can get anywhere with their doctor. Well, the 12 minutes is one thing, but like, where do you feel like we've gone wrong and are failing people?
I think ultimately, it's a system. We tried to make healthcare. I thought that's a hard question. I mean, where do I start? I'm trying not to, I'm not trying to take next. It's like, how do I answer that without talking for another hour? So I think it's a multifaceted, it's a systemic issue. I think the biggest issue with the system is when people started expecting someone else to pay for their healthcare, and people lost individual responsibility. So, the idea of companies providing insurance for employees, great benefit after World War II. We needed that to get people into the job market. It was a benefit, but over time, what happened was the expectation was someone else would take care of their health, and the people's lost basically their ownership of their own health. And so what's happened is now everything like obesity, for example, insurances don't really pay for most obesity treatments. Anything outside of this randomized, double-blind, placebo-controlled data network, what does the FDA, what do insurance companies, what will they pay for? And so what happened is now healthcare is being driven by reimbursement. And so what's happened now, people, because they've lost that intimacy, how much does it cost to get, EKG? It depends on which office, which insurance. You have no idea. I can't tell you what it costs in my office, And so what's happened now is as we transition to this complex care model where people have multiple issues, like how do we get people's head back in the game? How do we get people engaged again? And that's where I think the system's kind of failing us, because it's driven now by payers. So it's not me as, say, Jason, you come see me, I'm your doctor. I think this is the best thing for you. Insurance doesn't pay for it. Well, you don't want to do it because it's obviously not legit if insurance doesn't pay for it. And so now we've solidified that, well, this is not, using curcumin for your inflammation or boswellia, or using lipids, omega-3s for your rheumatoid arthritis. Insurance doesn't pay for that, so I don't want it. And so we've got this system that it's like the train's going one direction and the reimbursement system is keeping it going that direction. So I think like this is where, things like your podcast, grass level roots, just people know there's something missing now. And so that's where I think people get educated to ask for more. But ultimately, I think we expect too much of our insurance. We expect them to take care of everything. You don't expect your car insurance to, change your oil for you, or your house insurance to change your light bulbs for you. But we expect our government sanctioned insurance, approved insurance, to do more than our personal purchased insurance does for our belongings. And that's where I think we have to realize, if you want to maximize your health, you have to take ownership. And that, unfortunately, right now does not seem to be a really good message. When the prevailing message is everybody needs access, this is a right to get access to free healthcare. And ultimately, when you say it's a right, now everybody gets access, you've just taken the individual out of the equation, and that's right. That's the danger I see in that part of the conversation. We just need to educate people. We need to set up systems, set up groups so people get educated. And we need people out there. We need our prophets, our apostles, people saying, this is what's going on. We need people like yourself. And people want it, once they hear about functional medicine, integrative medicine, I joke about the holistic. I used to think holistic meant people with, crystals and magnets and all kinds of weird stuff,
Sure.
Yeah. But that's what people are really, when you talk about and describe, that's what people are looking for. If you come in, great example. Here's a story for you. You get this. I saw a lady with diabetes. I saw in my functional clinic for an intake 4 months ago. Her A1C was 12.
Okay.
So she's an intake, right? Terrible situation, felt terrible, awful. I saw her follow-up this week. She's off all her medications. Also, she was diagnosed with Addison's, which is an adrenal, basically, issue, diabetes. I diagnosed her sleep apnea. I found nutritional issues. I found mold in her house, okay, which is a big part. Address those. She's in the clinic, actually this past week. Her A1C is now 6.4. She's on no medications, okay? Sleep apnea is doing great. She's lost a bunch of weight. And it's like, that was me being engaged, learning about her house, learning about her environment. Diagnosing her sleep apnea, which wasn't hard to do, but just now people's radar. And that's where individualized, personalized care allows you the ability to have massive changes in people's. Her life has changed forever.
Yeah, no, it's the level of impact, and that's the thing is like so many physicians, and I don't know even these days, because like I'll just be honest with you, man. Like when I was working in ICU, like we had some guys that came through there, they were just straight up assholes. And I'm like, look, you're the one who signed up for this. you know that I'm an ICU nurse and I'm going to have to call your ass at 2 a.m. or 3 a.m. And you want to yell at me and bitch me out. I'm like, dude, you signed up for this. The reality is this is like now, and my wife is a pharmacist. And so we talk about this. We've talked about this quite a few times. Like if you're going into medicine or really any kind of medical career, right? Pharmacy, medicine, whatever, if you're doing it for the money, you're doing it for the wrong reason because you're going to live a very miserable life. The demand on you is going to be extremely high. Yeah, you got the money, but you don't have much quality of life if you're not in it for the right reason. And so I think that we're losing the ability to make that impact in people's lives with the non-holistic approach where I call it the Band-Aid system, right? Like we are not, we live in a world now where we have a drug for everything. Well, if we could make this shift to being more proactive about our health and had the country buy in, right? You talked about creating systems and groups and have a multifaceted approach. Maybe break up with the insurance companies. And people might be listening to this. They're like, well, how am I going to survive without insurance? The reality is you start taking better care of yourself. You're not going to need insurance. You're not going to need it as much as you think you do. You'll need it in a very bad situation. And in those situations, that's where insurance comes in, right? You get you get a cancer diagnosis or something like that, where it's like, all right, my life just like really changed overnight because now I'm told that I have cancer. That's where insurance comes in and says, hey, like, we're going to lend you a helping hand, not because you've been choosing to overeat for the last 10 years. You're 300 pounds and you have an A1C at 12. Like, that's not what we're going to help you with. You need to help yourself. We'll get you in contact with the right people to help you, but you got to want to help yourself. And I don't have all the answers. I know you don't have all the answers. I know that my purpose and passion is getting up and making an impact in the lives of other men so that they can live their best life. And it pains me to see this trend continue because I don't see a light at the end of the tunnel, at least right now. So,
I mean, I wish I could say I disagreed with that, but right now I have hope that things will get better. But what I'm seeing is this is what I'm seeing, and I'm a clinical researcher. Like I've done over 60 clinical studies. I've published in Lancet. I got all these kind of bells and whistles stuff. And what I'm seeing, the science is going in one direction, and the practice is going in a different direction.
Yeah.
And that's what's happening. So we're learning more about, immune modulators, nutrients with COVID, which is not new information. And we're learning all these cool things. And it's going the opposite direction of these protocols driven, institutionalized, mandated healthcare initiatives, right? They sound great, quality metrics, but quality metrics means I can't focus on you. I have to focus on what the insurance says is quality or the state says is quality. And so the data is going one way. And so the practice is going the other way. And that's where the question is, how, as we see the information change, can we educate people so we get more people following the data and pull the system our way? This has to be this is not going to be a top-down thing. It's going to be a ground level up thing. So we need enough people buying this, spending their money in it, engaged in it, asking their doctors about it, and then choosing to get their healthcare in alternative manners and ways that actually is going to ultimately make the system say, we need to provide people what they're asking for. Because our system is consumer driven, and that's where we have to realize that you vote with your dollars, and people aren't voting with their dollars and their feet. They can't really expect the system to change,
right?
If they're not forcing it to change. And that's where I feel like that's what probably needs to happen.
Yeah, I agree with you 100%. And I'm not, we don't have to go down the political rabbit hole here, but, I think at the end of the day, we get so caught up in personalities of presidents, who's the nice guy, who's the bad guy. And I'm not going to just say this election, that dates back as long as you want to go back, right? The whole blue versus red thing. And ultimately, if you're not voting with your dollar, you're going to end up becoming more and more and more dependent on the government. And that's just the reality. It's sad, but that's where we're headed. And I want to add something to that because I think that we are the fattest and sickest nation, or one of the top 2 or 3. But I had a guy on not long ago on our show that was from France, originally from France. And I said, I've always thought of France to be like, a fairly fit country. Like they eat healthy. They're very active. And, I made the joke. I'm like, the only chain restaurant that I can even think of that doesn't overserve you by like 2 portion sizes is La Madeleine. I'm like, La Madeleine gives you like the small little plate. And like you think like, wait a minute, I paid $9 for this, but like, that's where we should be at. He's like, man, It's like, I wish I could tell you different, but the trend is now happening in France too, where we're becoming more and more dependent on social media, technology, Siri, Alexa, and we're living off of fast food. And our country is starting to become fatter and fatter as well. So I think it's a worldwide trend, especially where technology is more accessible. I just hope that we can put a stop to it. So I want to transition now. Obviously, we chatted about this a little bit before the show. I'm known as the healthy fat guy in our company. That's the thing that I push most on a lot of our guys, because I've been doing what I've been doing for a long time, and it just gets results. I feel like the more healthy fats that I eat, the leaner I'm able to get. And so with all that being said, I want to talk about, you mentioned adopting your daughter. You mentioned helping people with chronic conditions. And let's unpack the nutrition piece, because I find it fascinating that you mentioned, you got, how much did you say education you got in medical school in terms of nutrition, like 5 hours or something?
Yeah, it's between 4. The national numbers are between 4 and 6 hours. I throw 5 because it's kind of sort of in the middle.
Yeah. So basically nothing. And you're making decisions that are going to impact the lives of people for a really long time. There's, one of the, I don't know what the book is, but one of the oldest sayings in the book is, we are what we eat. And I don't think that anybody out there will really dispute that. I mean, the reality is if you live off of candy and processed carbs and fast food all the time, you're going to get fat, you're going to have chronic conditions, and you're probably going to die at a young age. I mean, that's the facts. That's the trend. The data shows that. So let's go to nutrition, and we can even tie in the virus piece, because I know that we talked about that a little bit, not just COVID, but like viruses in general. Let's talk nutrition. Talk a little bit about how you've been able to help your daughter and what kind of things you got going on there. And then we can even go a little bit more cellular in terms of the healthy fat, so that more guys out there know why it's so important to place such an emphasis on this, I'll call it the miracle macronutrient.
Yeah. I mean, I think, healthy fats are one of the biohacks. It's like one of the unmentioned biohacks. People talk about all these fancy things, and no one's talking about using fats as the ultimate biohack. I mean, our cells in our body, the substructure for our cells are fats. 40% of our cell walls are cholesterol. Your hormones, your male hormones, are actually made out of cholesterol molecules. Your neurons are actually surrounded by an insulation of fat. And so the healthy fats and the right ratios are crazy, crazy important. And so with our daughter, as we adopted her, she has cerebral palsy. And so as we started doing nutritional interventions with analysis, she is like what got me down this road, because when we adopted her, I didn't tell you this story, but do you mind if I tell this real quick?
Yeah, absolutely, man.
So basically we adopted my daughter. I'll be brief with this, but the pediatric GI doctor wanted to put a feeding tube in her stomach because she was underweight. And so they're going to pour, you put a feeding tube, you just pour basically,
whatever.
Pedialyte, exactly. In there. She gained weight, right? Get healthy fat, right? And so my wife, who's a pediatric OT, explained to me why that affects speech, it affects crawling. Our goals were for her to walk and talk and crawl and walk and all these kind of things. And so,
how old was she when this happened?
She was probably maybe between 14 and 16 months old.
Okay, and so you guys adopted her really young.
We took her into our house when she was 12 months old. It took about a year or two for the adoption process to go through. So we started as foster, and she was actually one of my wife's patients. So
oh wow, that's awesome.
Her foster home was disappearing, and my wife was like, "Hey, you want to bring this little girl in the house?" And me being, oh, sure, why not?
Yeah, let's do it.
Well, my thinking back then was, we can always give her back. I'm totally serious. Like, it's a guy, you're a guy, you're like, oh, and then fall in love with her. Took me about 6 months, fall in love with her, and I'm spending the rest of my life fighting for it.
I love it.
It's just funny how things change, but it just didn't feel right. So we chose not to do that. 6 months later, my wife came across a pediatric growth chart for kids with CP. My daughter was right in the middle. The pediatric GI expert had no idea my daughter was fine for a kid with CP and wanted to do a surgical procedure to make her just gain weight. And that was when, I kind of realized there's something wrong with the system where we're not looking at other options. And so one of the first things we did was change our diet, start putting healthier fats in the thing. And so healthy lipids, omega-3s, healthy orals, extra virgin olive oil, all these kind of things. I learned that they actually help with neurological conditions. They help with gut health. They help with hormonal health. Your body actually detoxifies a lot of fat-soluble toxins through fat, whether it's you sweat it through your skin, you poop it out through your liver. And so we start introducing these things into our diet. As I studied, I learned actually that there's actually clinics at Hopkins, like one of the top lab places in the world, the paroxysmal clinic there, the Kennedy Kruger Institute. They literally do biopsies of people's fat with neurological issues to ensure people have deficiencies in 6s and 3s and phospholipids and all these other things, which big words for a lot of stuff. But the point is our American diet is filled full of inflammatory, processed, I call them partially plasticized. The plastic computer actually is just, it used to be a liquid back in the day, right? Oral. And we turn it into a plastic computer, right? Well, that's what margarine is. That's what, I can't believe it's not butter. I can't believe it's not butter. It's partially plasticized vegetable oil. You put that into a cell membrane, and this thing is supposed to be super pliable and movable. All of a sudden it's thick and rigid, and hormones don't work as well. You don't detoxify quite as well. The transmission of electrical signals in your body get messed up. And there's a whole host of bad effects. And now we understand, I'm not sure what you talked about in your podcast with the microbiome and gut bacteria and how diet impacts that. Oils, olive oil is one of the best, the polyphenols, the chemicals in olive oil are one of the best foods for those little boogers that actually decrease systemic inflammation. That's crazy. So now we're talking about oils decreasing inflammation, improving cell function, improving detoxification, improving brain health. And most of the oils in the store are processed so they last long on the shelf.
Right.
And once you eat those, guess what? They last a long time in your cells and they're hard to get out. And the consequences are really, really bad. There's an interesting statistic in 1900, cardiovascular disease was pretty uncommon. And almost all cardiovascular disease was caused by infections. By the 1950s, when we eradicated most of the major infections with antibiotics, cardiovascular disease became the number one killer in our country by 1950. And that was from inflammatory stuff. And the biggest change in our food system that happened between 1900 and 1950 wasn't sugar, it wasn't processed foods, because sugar entered our food system back in the 1500s. It actually was processed oils were the new thing that entered our food system in that time frame. And so I think once you look at the history of it and you understand how bad fats are for you, you'll want to start cleaning up your diet. And that's one of the first things I tell my patients is just get rid of the fake fat, get healthy fats, Yeah.
No, I love it. And so let's talk that for a second. I mean, there's a lot of guys out there like, okay, well, this is great information, but what are the bad fats, And so, and we could talk, we don't have to go too deep, but like when you're talking bad fat, when you see, I can't believe it's not butter, you need to stay away from it, right? Like I tell all of our guys, like, look, man, just get grass-fed butter. If you want the real thing, we buy the Kerrygold salt-free butter. Use it, man. Like that, it's okay. I think what we had was this big shift away from fats in our society with, I don't know if you've read the book, The Great Cholesterol Myth. But these studies that we did on the rabbits way back when, right? Like we tested rabbits, and it's an animal that clearly lives off of greens, and introduced, the animal product into their life, and it gave them heart disease. Well, like, okay, well now we're going to use the same thing on people when we're actually meant to eat that stuff, right? And so I think that we had this big push to get fat out of the diet. And what did we replace it with, right? Sugar. And now we've got, because you take fat out, you got to replace it with something to add the taste back in. Well, sugar or processed carbohydrates or sugar alcohols, all these things come in all shapes and sizes. But what are the major things that you would tell somebody out there to steer clear of, especially if you're on your weekly grocery shopping trip and you're trying to pick the good oils, trying to stay away from the bad fats? Like, what is there a handful of them that you would say, look, don't ever buy that?
I wouldn't ever buy any corn oil or vegetable oil. Corn, they're high, they're actually processed. Most of the corn actually is genetically modified. It has this thing called Bt toxin in it. They're sprayed with glyphosate, and it gets concentrated in the oils. And all these oils actually, they process them in a way that they maximize shelf life. You don't want to put something in your body that has a 5-year shelf life. You want to put something in your system that, you want, like the example I give people is bread. I used to, in college at VCU, live down from the Wonder Bread factory. And you can have a loaf of bread that would stay in your apartment for a month. The bread my wife makes at home, it'll mold in 3 days. And the difference is part of that is the oils you put in there to preserve it. So you want to avoid corn oil, soy oil, canola oil. People think canola oil is a healthy oil. Canola oil actually comes from rapeseed. Canola oil originally was used as a motor oil in Canada in the late 1800s.
Wow.
And they have to deodorize it. They use a solvent to deodorize so it doesn't smell that bad. You don't want to put that in your body. So the easiest thing to do is just start transitioning. Slowly just replace the bad stuff with the good stuff. Focus on clean avocado oil. And one of the reasons I love Costco for many reasons, they actually have some decent selections of avocado oil from Mexico, extra virgin olive oil at affordable price from Spain and Mediterranean, and start transitioning to healthy butter. Ghee is a great product. If you have any dairy issues, just get ghee. They've been using ghee in India for 3,000. Oh, I'm sorry, it's 2,500. So over 4,000 years.
Wow.
Ghee is great for your brain. They were actually using it in Ayurvedic medicine to treat neurological issues like Parkinson's 2000 BC. It's got a lot of great gut health benefits. So transition to healthy butter, ghee, avocado, olive oil, coconut oil, which is a saturated fat, can be good. I think we've gotten a little crazy with coconut oil in our diets and processing it. There's a lot of things with that, but I think the biggest thing is remove the vegetable oils and remove the processed oils. So and unfortunately, what that means is all the box foods, if you look at them, they don't have some kind of processed vegetable, corn, canola, sorrel, whatever. So you almost have to kind of just start transitioning to less box stuff.
Sure.
Unless it's something specific that like only has like 4 ingredients. But I think that's the first thing, is just transitioning out bad fats and transitioning in healthy fats.
No, I love it. And I think you kind of hit on this, but like if your food can go bad, it's good for you. And if it can't go bad, it's not good for you, right? Like that's the reality, is like if your food has a super long shelf life, chances are there's some things in there that you don't want in your body. I'm glad that you brought up, if it has 4 or 5 ingredients, because one of the things that we get requests on most is like, hey, like, what kind of bars can I get? What kind of bars can I get that are going to be, that aren't super unhealthy, that aren't loaded up? And so I've done a lot of research on certain bars and have identified those because, that's an easy fix for guys that are on the go, and so a lot of these bars that I'm recommending now, like Kashi has one that's grain free. There's only like 5 grams of added sugar, and it's like, I know it's like 200 calories, like 14 grams of fat, because it's like coconut, almond, or something like that. And I'm like, dude, like 200 calories, you can get that thing down in 30 seconds and be on your way. And it tastes really good. Things like that. You can pronounce all the ingredients on there. So I think there's exceptions to every rule. But yeah, I agree with you. Like most of the stuff that's in the pantry, if it's, any kind of carbohydrate product that's got all the oils in it, aren't probably going to be good for you. Things like quinoa and black rice and stuff like that. Obviously, there's a time and a place for the pantry stuff. But with the healthy fats, like, I'm very big on avocados. What is your take? Let's take we don't even have to go a long debate on this, but what is your take on eggs?
Yeah, so I think eggs are either a toxic, highly allergenic food product, or they're a superfood. So which one is it? So, if you have an egg from a chicken that's fed genetically modified soy and grain that has antibiotics put in its feed to keep infections down, make them grow quicker. I don't know if you knew that they used to put arsenic in the chicken feed until 2012. And it was a voluntary withdrawal of that in the chicken feed because it makes chickens grow faster. We have 20,000 chickens in one place. They're breathing their own feces, eating their own feces.
Yeah.
The chickens are so sick with infection that when the eggs come out, they have to bleach it and irradiate it. So now that egg that I'm talking about is in your grocery store. Is that a healthy, amazing, anti-allergenic, anti-anaphylaxis?
Probably not.
Brain. Okay, you're right. Probably not. So we actually have chickens here. We raise our own cows as well. We kind of take things a little extreme. My wife and I take things a little extreme. But if your chickens are eating bugs, they're out in the sun, they're the supplement you have
free range and not stressed out. Yeah.
Yeah. The egg, and like it's literally the egg you get. It comes out from back there. I can leave it on my countertop for weeks with no problems. My brother's a chef, and the first time he came to my house with my eggs out, he was like, "What? They're not in the fridge?" I'm like, "Real eggs don't need to be in the fridge." He's like, "They'll go bad. They'll rot." I'm like, "I can take these eggs a month later, put them under a hen, and I get, and in 28 days I get chicks." It's like because we have a rooster, and he kind of does this thing, and all of our eggs are fertilized. But the point is, like, so if you get that, and it's really interesting because some of Dr. King's work in the neurolipid clinic, she actually recommends eggs for kids with neurological issues because the yolk has so much phospholipid, which is a healthy fat for brain function, and albumin is one of the like complete proteins. So either eggs are this amazing thing or they're toxic for you. And I think that's where sourcing and knowing you eat what you ate. So if your chicken's eating healthy, what's designed, what you said before, if it's eating what it was designed to eat, then you know what, those eggs are probably amazing for you. You know, if it's eating a bunch of crazy stuff, I mean, you can. I grew up in Harrisonburg, out in the Shenandoah Valley, which when I was a kid was the poultry capital of the world.
Okay.
And you could smell the chicken houses miles and miles away. And once you get there, you have to adjust yourself to the ammonia the smell. And sometimes the ammonia levels will get so high, it actually became dangerous to go into coops.
Oh, wow.
The chickens were in these things all the time. So is the meat from those things, is the eggs from those things really that amazing for you? And it's really interesting because a lot of people don't realize the feed they give chickens is provided to them by the manufacturer, that's Poly Farms, Purdue, whatever. And the farmers don't know what they're giving the chickens. And it's super cheap feed that's highly processed.
Yeah.
So, you know, is that product amazing for you? I think that's, you know, and that's why I think a lot of things like beef, meats, you know, fish, you know, salmon, you know, you say you eat fish and things like salmon, you know, if you get a farmed salmon actually looks like tilapia. The meat's actually kind of this pale gray color. They have to dye it orange.
Right.
Okay. Well, why is real salmon orange? Because they eat krill and algae, and that stuff is a thing called astaxanthin, which is actually a orange dye, which is a polyphenol. It's an anti-inflammatory. It's super amazing for you. It gets concentrated in the meat. So even salmon, either it's super amazing for you or probably not. And ultimately, that's the sourcing becomes super, super important.
Yeah, no, you hit on some great facts there. And I often talk about, like, I'm glad you went there, because I tell a lot of our guys, it's like, if your chicken breast is the size of an NFL football, you don't want to be eating that, right? Like you see these things, they're giant. I'm like, dude, if you're going to spend a little bit more money, just buy the organic grass-fed chicken breast. You're going to pay a little bit more, but you at least know that you're getting better quality meat. You know, the grass-fed beef thing, like if we're going to, I'll tell you, if we're going to grill out, like we're doing a big, you know, couple of big, like New York strips, well, I'm not going to buy the $40 grass-fed New York strip. That's a one-off. Like we don't do that often. But if I'm buying if I'm buying some beef and we're going to make like a meal that's going to give us 3 or 4 meals for the week, then I'm going to buy the grass-fed beef, you know? And so I think guys out there that are looking to, you know, improve their health and improve their nutrition, it's one of those, you got to pick and choose and become more informed, become knowledgeable. I'm very big on reading the Dirty Dozen list, you know, and I made this change not that long ago where, you know, I started buying all organic berries. Strawberries and spinach are usually at the top of that list. And we eat a lot of spinach. And so I was like, I'm not buying any more non-organic spinach. I'm not going to buy my kid pesticide-filled strawberries anymore. And right now, strawberries are, you don't want the organic one, it's like $7. I'm like, sorry, buddy, you're going to have to wait on strawberries for a little while, right? Because he'll eat the whole thing in one sitting. I'm like, dude, that's a meal for you. So I love that you went there, because I think it really comes down to becoming more informed about the foods that you're putting into your body, and making the decision. Where are you willing to waver a little bit? Where are you willing to sacrifice for long-term health? Would you agree with that?
Oh, I mean, I think, you know, the reality is you want to set people up for success.
Right.
You know, it took me about, and what I tell my patients all the time, it took me about 1.5 years to source all the food for my family. And that was with my wife also doing a lot of research and us putting our 2 heads together. So if it took me 1.5 years to figure it out, and this is like my job,
yeah,
you know, it's good to probably take my patient, you know, a little time. I put this little thing together that helps accelerate that process so they can kind of figure things out. But it's a process, it's a journey. It's just not overnight. The Clean 15 Dirty Dozen that you mentioned, Jason, that's an awesome resource. They have an app on their phone that I routinely pull out because I'm kind of thinking it's cabbage or which, you know, Brussels, which wears it out on the thing, you know. Avocados, which you mentioned you love, they're like low spray. They don't have to be organic, which is, you know, I should like buy Costco stock because I keep on mentioning them, but they're the cheapest place, at least where I'm at, to get organic avocados, organic blueberries when they're in season, and you get in bulk. And we just let our kids go crazy. But also means we're not doing blueberries in January because they're crazy expensive and they're coming from Peru, you know?
Right. No, we're on the same page there. So do you believe, like, in terms of like the thickness of the skin, like, or do you buy organic avocados, or are you like, it doesn't have to be organic?
It doesn't have to be.
Yeah.
Because there's some things that don't have they don't have a high pest concern. Like avocados and coconuts, for example, there's not a lot of pests that there's actually a crab that climbs up the trees and gets coconuts, coconut crab. But there's not a lot that gets on them. Asparagus isn't sprayed a whole lot. Strawberries are one of the highest, apples, highest sprayed. Blueberries, actually, we have a local blueberry farm here, Swift Creek Berry Farm. I'll give a little shout out to them. I know the family, they do a great job of their blueberries. They basically just put a little fertilizer and that's it. Blueberries don't have a lot of, their biggest, threat are birds, birds and deer. And so if you know your local farmer for that, they don't have to be necessarily organic because they don't need to spray them.
Sure.
Strawberries, unless someone tells you specifically, I don't spray, come look at it. I assume they do because unless you're doing everything perfectly, it requires a lot of input to keep them from molding. So that's
they're tough. They're tough to grow. It's like bananas, it's got a thick skin, oranges, thick skin. So try to go off that a little bit. But yeah, man, I think this has been great. I think that our guys are going to get a lot of value out of this episode. I know we've covered a lot today. But if anybody wants to learn a little bit more about you, who you are, what you do, and how you might be able to help them, like where can we find you? Any websites, any social media links, anything like that?
Yeah, definitely. My website is rvaintegrative.com or richmondfunctionalmedicine.com. If you Google my name in functional medicine, Richmond, it pops right up. You can, Instagram, RVA Integrative, Facebook, RVA Integrative. And we've actually started an online community focused on me doing education for patients to kind of guide them through this, and actually created like a roadmap to resilience. It's basically a coursework that actually walks people through how do you focus on diet, lifestyle, exercise, sleep. These are the foundations of functional medicine, actually. So, and it kind of walks people through these things. And the last part of it, of the roadmap, is actually the mind-body connection. And I feel like this is where a lot of my patients struggle. They hear the information and they get to they get into the trenches, and they just have to have their mind in the game, and it's hard to make changes. So that's part of that as well, talking to people how you actually institute these changes for longevity, not just it's a marathon, not a sprint.
Yes.
I always tell people the tortoise wins the race. Okay, so it's like you got to realize, okay, I'm the tortoise. You're going to win the race, but just
I love it. No, we talk about that often. It's like you got to have a vision for yourself. So many the guys that come to us, right? Most of them are like they're sick and tired of being sick and tired, and they had their eye on that 50-pound or that 80, 100-pound weight loss goal. It's like, look, man, like yes, that's going to happen for you. You can't lose sight of the longer term vision because you are going to reach your goal. Like that's going to happen for you. But the reality is life doesn't just suddenly stop. You can't go back to your old ways. Like what we're going to teach you is a way to live that's going to give you a permanent solution. We want to be the guy's last stop, right? Like we want you to have a solution for life. So I'm glad you brought that up because it's so important to have the mind-body connection. We're very big on telling the why behind the how. I feel like most people, if I told you how to do something and you don't know why you're doing it, probably not going to follow through. But I tell you why you're doing it and why it's going to get you results, a little easier to get that extra motivation you need on days where it's lacking. Do you agree with that?
Absolutely, yeah. You got to know why you're doing something. Telling someone to do something, that's very old school, authoritarian. If you don't tell someone, like, this is the reason you should do it. That's where the education, encouragement, empowerment. I'll put education first. Empowerment's the do, right? Like do this. I'll put that last because we don't know what you're doing and you're not encouraged to do it. You're not going to be empowered to actually make it happen. And so that's where what you're talking about is super, super important. If you want people to actually change the trajectory of their health, their lives, their families, then they have to know why it's important, not just telling you how to do it. Yeah, you got to do both, but you do want the why before the how. That's the kind of way I kind of tend to do things.
No, I love it. I love it. Yeah, we're very aligned on that, man. Well, this has been an awesome interview. We'll get, the websites and the links and all that stuff in the show notes as well. So just want to say thank you again for taking some time out of your day and coming and joining us. And if you're up for it, I'd love to do it again in the future. I think we could go on and on for a while about this stuff. So
yeah, we'd love it. This is a great time. We actually talked more about the fats before the thing started.
No, we could, I'm telling you, it could be a Joe Rogan style 5-hour, man. There's a lot to unpack. And so definitely would love to set up a part 2 with you in the future.
Yeah, sounds awesome. Yeah, awesome. Cool. Thank you very much. Really appreciate you inviting me as well, Jason, to be a part of this. And hopefully this will be really encouraging to your listeners. I hear your heart. You're really trying to change people's lives. And so hopefully as you get different people, you can just basically empower people to make those changes they have the ability to do,
Yeah. Thank you so much, man. I appreciate your kind words, and we'll do it again in the future. Have a great rest of your week.
You take care. Be well.